Today we're very happy to have Dennis Anderson with us to give today's talk. Dennis is a former MLA and Alberta Cabinet Minister, and currently the Consul General for Thailand and a mental health advocate here in Alberta. He's a founding chair of the Alberta Alliance on Mental Health and Mental Illness, uniting provincial mental health not-for-profit organizations and mental health professional organizations in advocacy. He's the founding chair of Lieutenant Governor's Circle on Mental Health and Addiction, founder of the Chemo Project for Animal-Assisted Therapy. Is it CHIMO? CHIMO. And he's currently the director of the Mental Health Commission of Canada, although he informs me that he's in his final days of that. Anyways, it gives us great pleasure to introduce Dennis Anderson.
Well, thank you very much for the kind introduction, and thank you to the ethics organization that not only has invited me, but that has as well had quite a number of years of bringing people forward who can give information on health to all who might want it and might need it. I very much today hope that some of you, and I don't see you eating, so I hope I don't make you hungry in this period of time that I'm speaking for. Of course, the topic is, as indicated, I'm going to deal with the lack of connections in mental health organizations and various things and deal with that. But I also want to talk about what has happened with mental health in the 40-some-odd years that I've had some involvement with it over my life. Before starting, maybe I'll just tell a little joke. How many psychiatrists does it take to change a light bulb? Only one, but the light bulb has to really want to change. And, you know, that's a little bit of a reality because although psychiatrists are a very important part of any mental health assistance, the fact of the matter is that they need all of the assistance of not just other professionals in the area, but of those of us who can develop some sort of sense for those people we know who have a mental health problem. First, before dealing with the issues involved, though, I want to say that over these last 40 years, many improvements have happened in mental health. Many things have improved. For example, at one time, it was thought that it was the devil that was giving people problems of mental health, mental illness, really mental illness. And it was also, for a while, thought that a person was born insane, and that was the problem. At least today, generally speaking, we don't feel that that's the way. We believe and know there's more complex issues that we have to deal with in that regard. And this country, from one end of it to another, has in fact set up hundreds, thousands of mental health programs to help in different ways. For example, I was fortunate, and I'm fortunate to still talk to Senator Michael Kirby, who was the senator who headed the group that recommended the Mental Health Commission of Canada, designed to bring together all of us who are able to assist in that regard, assist in improving mental health as it's possible. And the previous government put that commission in place, and it has done many positive things. So I will talk a bit more of it later. In every province, in every place, there are a whole great number of issues. In Alberta, groups like CASA, which is maybe the most effective group for children's mental illness in the country, is here. Even Alberta Health Services has many programs to deal with mental health issues. We have groups like the Dreamcatcher that was set up by Elaine Bona, which is an animal-assisted therapy program that helps people with problems using all kinds of different animals and primarily assists with Indigenous Albertans. We have the Calgary Centre for Suicide Prevention. We have a group just this week that went to the City Council here in Calgary and talked about what we need to do to help reduce the whole idea of suicide. And we have to thank Alberta Premier Rachel Notley, because just a couple of weeks after she was first made Premier of this province, she appointed a committee called the Mental Health Review Committee. And that particular committee was also the first time I've ever seen one that was nonpartisan. She made the leader of the Liberal Party, Dr. David Swan, and the now Minister, Daniel Larrivee, as co-chairs of that committee. And I was fortunate enough to work with that committee as it went through deciding its issues and the kind of recommendations it would make. And now I am fortunate to chair with Scott Phillips, who is with the Department of Psychiatry here at this University of Alberta, a group of up to 30 different organizations trying to assist the government in finding ways to make those kind of recommendations work and work properly. Well, another positive thing that I have to say, especially being here where I am, which is not just in the hospital, but in where the psychiatric department of the University of Alberta is that I'll tell you that quietly, it was quietly, but I used to say to myself, academia knows the answers to many of the problems that we have with regards to the issues in mental health, and they sit in their ivory tower and they don't come down and help the community deal with that. Well, I'm dead wrong. This psychiatric department is right in the middle of trying to assist the community to do that. And whether it's Dr. Greenshaw or Dr. Shimin Lai, or right here with us today, one of the most active and best people in that regard, and has been for a long time, Dr. Roger Bland. This university psychiatric department has been trying very hard to do a great deal for mental health. Now that's the good news, and there's a lot more in terms of programs in this province and others in other parts of our nation, other parts of our world that are trying to help deal with mental illness and help people to become mentally healthy. But now, I'm afraid, here's the bad news. Despite all of those assistance, despite all of those changes, despite the programs that are being announced constantly and put in place, we don't have less, we have more depression, we have more anxiety. Alberta has the second highest suicide rates in the country, Quebec being the highest. And I don't know, that we may have passed Quebec this year because the Calgary Suicide Prevention Organization says that the rate of suicides in Alberta has gone up 30% in just the last year, which they're attributing to the loss of the oil prices and jobs. And whatever is their issue, there's no question that those problems are still there. So why, with all of the things that are happening, why with a different look at mental health, that it's not just something that's caused by something beyond this earth, is that all happening? Well, I'm sure many people here, I know Roger would, and many others in any other provinces would have different thoughts on why that is. But mine is the basic, simple problem is a lack of connections. And when I say a lack of connections, I mean a lack of connections between family members, a lack of connection even between people and animals that I'll talk more about, between doctors and programs, between the government and NGOs, and even between friends. And we'll start with youth. You know, according to the Mental Health Centre in Ontario, 70%, at least 70% of all mental health problems start in our youth. And I truly believe that that is the case. And let me tell you about my own childhood. But before I do that, I'll just say this from Robin Williams, who said, "I used to think the worst thing in life was to end up alone. It's not. The worst thing in life is to end up with people that make you feel alone." And unfortunately, my childhood, like many others, was in that category. My mother was a hard-line woman. I know she must have had some mental health problems of her own that never got dealt with or seen of. But she was hardline. I didn't have friends. I didn't have anybody. I couldn't play sports because my mother kept me under control day and night and told me always that I was useless, worthless, and would never be anything but a garbage collector. Well, I don't think being a garbage collector is a bad thing, but I sure did then, and it was a negative feeling that I had of myself through my childhood. And yeah, like all children, once in a while there was something positive that made you dream. For me, I read a lot, and I remember reading about Napoleon Bonaparte. And Napoleon was born on August the 16th, 1769, and I was born on August the 16th, 1949. And he had relatives out of Corsica, and I had relatives in Corsica too. So for a little while I walked around with my hand in my shirt and thought maybe someday I could, rather be than I be a garbage collector, be Napoleon. But that didn't last for long. And I'll give you the worst time, which is faced by more children than we think. And that was, I got up, went to go to school, put on the rubber boots. My mother said, "Yeah, those boots, they were your grandfather's. He committed suicide." Well, I didn't know him very well. For some reason, that made me feel like I was responsible for that. I went to school, I put the boots in a locker. I did a couple of classes. I came back to the locker, opened it. Boots fell out. There was urine and feces all over the floor that some bully or bullies had put in there. Teacher came by, grabbed me by the ear, yelled at me, put me on the floor, threw me some papers, made me clean up, threw some of her perfume on me, and then made me stay after school for a detention. And when she did that, of course, I got home late. My mother beat me and told me how worthless and useless I was, of course. And as was true with many, many nights, and I still have trouble sleeping. I didn't sleep a bit that night. I got up. I tried to clean the house from one end to the other rather than go to school because I had always been told I couldn't clean anything. And then I walked for a long ways, quite a couple of miles, to a bridge. I had seen on television somebody jumping off one, and I thought it was time that I just ended all there was. And I got there, and I went to put my foot up on the rail of the bridge, and the dog grabbed my pant leg and pulled it. And I looked down, and she looked very concerned. It was a dog we had at home, Sally. And all of a sudden, I felt something, thought I was worth something. And so I walked back with the dog. And as long as the dog lived, she was what kept me feeling of some worth in my life. I left home very young. I went I joined a church, and I'm glad I did because it gave me a feeling of worth for a couple of years. I'm not religious now, and I left it when they wanted me to plan when I was 18 to go on a mission because I had to then think about whether I really, truly believed and decided I couldn't. But I'm very thankful to the church for what it had given me at the time. And I was living in a group home with a guy who'd been traveling around North America, who was quite about 70 years older than I was, but very bright. We'd read books together and we'd talk philosophy and the rest of it. And he kept telling me I should go to Rochdale College in in Toronto. Well, I'd barely ever been out of Calgary, in my life, but and Rochdale College was a brand new approach to academia where anybody could go without a prerequisite. Anybody could learn what they wanted to learn. They didn't even have really professors. They had people who would help you learn at your own rate of speed with whatever you wanted. Sounded like a great deal to me. And he said, well, and you can be employment director, because I was 17. I thought, how could I do that? But I was managing a couple of students for the summer, painting fences and digging tree holes and that kind of thing. And so he phoned, and they said, yeah, have him come and be employment director, which was absolutely amazing. And so since I had nothing else in life, I threw a couple of clothes in a box. I couldn't afford a suitcase. Got enough money to just get to Toronto, and there's a communal house that he'd arranged for me to go to, and I could tell long stories about that none of us have time to hear this afternoon. But I went there. It was a former. I'll just say it was a former. It was a former funeral home, so I got to stay in the embalming room, and that was a little different. Went to Rochdale College the next day, and I had my only suit and a brush cut, and I came, and everybody, of course, had long hair and beards, and kept looking at me weird, and I kept looking for this registrar. Finally found him. He was in a room with a bunch of smoke with some others. Of course, I didn't even know what that smoke was at that point in time. But I said, yeah, I'm supposed to be employment director. Yeah, man, do your thing. Is there an office? Yeah, man, go find one somewhere. So I did. Everybody thought I was a narc because I was dressed in a suit. I learned in a couple of days to try and change how that was. And what had happened was, of course, that was the hippie era when it hit. Not out here yet. We were still pretty straight. It was when it had hit in Toronto. And Yorkville was the primary center for that point of time. And Rochdale, which had intended to be, was really created by the U of T students initially, was really intended to be a whole different look at how you deal with advanced education. They managed to get, amazingly, a funding from the federal government to build an 18-story building. But because they didn't have any prerequisite for going to deal with education, they didn't have a prerequisite for you moving into an apartment in the building. So the Yorkville hippies, by and large, moved in there. And within a couple of months, unfortunately, the academic aspect of it was pretty well gone. Maybe 3 courses dealing with, sexuality or something in the place. I learned, although I'd been trying hard to have some sort of employment thing for youth, that they needed a drug crisis center as opposed to a youth center. And amazingly, I was able to get a couple of volunteer organizations to give me a little bit of funds to go out to New York and Washington, and then to in fact talk to people and learn a little bit how to deal with drug issues. Only a little. I'm not saying I became anywhere as a perfect counselor for that kind of thing, but at least I came back and I started the Drug Crisis Center, Rochdale Drug Crisis Center, and the thing I could do that others couldn't, again because of the lack of connections that I'm talking about, is that of course the world had changed. We had more youth in Canada than ever in that age category, and they were not comfortable going anywhere near people in white coats who were professionals of various sorts, no matter how much they might need them. They wanted to keep away from all. But because I was their age and I stopped wearing the suit and started having a bit of longer hair and so on, I could at least communicate with them and get them involved and try to help them. And it was a fascinating, interesting, depressing period of time. I did it for a couple of years, and at one point thought, yeah, maybe I'll, go get the education, become a social worker or a psychologist or maybe even a psychiatrist. But, after 3 people, 1 girl and 2 guys, died virtually in my arms from drug overdoses, or in one case it was just bad drug. I knew that I couldn't live day to day in an occupation that had me doing that kind of thing. Thankfully, I was asked to come back to Calgary to go to a radio station and to talk about this stuff because Calgary and Edmonton and a lot, I think, of the rest of Western Canada was just beginning then to see the hippie era, the drug problems, those other issues that Toronto and parts of the U.S. had been heavily with for quite some time. And so I did that. And when I did a couple of those shows, I thought maybe that's what I can do. I can help people by this more macro way. And so I went and learned how to become a broadcaster, came back to Calgary, got a job with a radio station, had 2 programs, We the People and Justice Alberta. We the People in particular, I could interview and investigate every problem there was and people who could solve those problems. And I interviewed almost every major political leader there was of the day. And after a couple of years of that, I thought maybe I could go into politics and really change things. And so at 21, I ran for the school board in Calgary and lost. And then a couple more years in broadcasting, I ran for the legislature and won. And I spent 15 years and almost 15 years in the Alberta legislature. And I want to tell you a little bit about politics for all of those of you who haven't had the kind of direct involvement I had. First of all, people really don't realize that 90% of those who run, regardless of what political party they are, try to do so for the right reason. I may not agree with them, I may disagree with the directions, but they try for one right reason or another. Having said that, it's a very difficult, it's not the only very difficult occupation, but it's a very difficult occupation. There's pressure day and night. Pressure from the public, pressure from the media, pressure from your leader, pressure from the opposition, pressure from your own colleagues because of the pressure they're getting from their constituents. It is day and night, it's holidays and not holidays that it's there. And so it's hard for individuals to concentrate on making long-term changes the way it should happen in our society. Very hard for them to do that. The other thing I need to tell you is that, when premiers and prime ministers appoint cabinet, they do not, in most cases, appoint individuals who want to do the most in that area. Because if they do, then they get people fighting hard in the cabinet for the budget or for the issues. And so I'm a good example of that. I wanted to be Minister of Health or Minister of Social Assistance. Instead, I was Culture Minister, Multiculture, Municipal Affairs, Housing, Consumer and Corporate Affairs. And one of them is a little humorous. The first time I went to Government House and was asked by the Premier if I'd be Minister of Culture, I said yes, went back to my office. A little while later he called and he said, "Oh, I forgot, I'm starting a new portfolio on women's affairs, and would you take that as well?" And I said yes, and hung up, and then thought about it for about an hour, and then I phoned him back and said, "You sure you want to call it women's affairs? Because I don't know if I have a right to determine whether a woman should have an affair or not. Maybe we should call it something like women's issues." And that was what we did call it, and we proceeded through that. But the other thing with politics, And it's true right on through. And you must know it, all of you who are involved in healthcare. And it's more obvious in politics. Physical health always has a priority over mental health. Not because people necessarily think one is more important than the other, because you can see physical health problems, or you can find out what they are. You can talk specifically about them and potential solutions. We are still evolving in mental health, both a knowledge of it, believe it or not, and the different ways that there could be to deal with the issues, which frankly are just about individual all the way through all of the problems. And so that is one of the problems politically about putting mental health where it should be at the priority list there needs to be. Well, after 15 years in politics, I did, in fact, leave and was asked to be the Alberta president of the Canadian Mental Health Association on the national executive. And I thought, gee, I know the Premier and I know the Cabinet and I can make things happen now. And then when I tried to do that, of course, the Premier or the Minister would say, yeah, you're saying that from Canadian Mental Health, but gee, we're hearing this from the psychologists, and we're hearing this from the schizophrenics, and we're hearing this from the other programs. And so then I brought together a lot of these organizations, the psychiatrists, the psychologists, and yes, Canadian Mental Health, and the Schizophrenia Society, and it was true. When we got into the same room, the psychologists and psychiatrists were arguing about which one of them should be getting more government assistance and what the government should be paying for each of them, and this kind of thing. The Schizophrenia Society was saying we shouldn't be talking about mental health, we should be talking about mental illness, and of course the Canadian Mental Health was saying we should be talking about mental health. And I had to stop the conversation and say, regardless of the different feelings we've got and the different needs in our different organizations, we have to determine whether there are changes that are necessary in mental health that we all agree with, that we can try and get the government to move on. And there was some success in that. We established the Alberta Alliance for Mental Illness and Mental Health, which has existed now for about 18 years, and it does help. But of course, it is a connection, but it is not all the connections that has to happen. So that was it. One of the additional problems of today is negative connections, and that is, in my opinion, from the social media. People don't talk and get to know each other's issues and problems, and just be able to help as people, not necessarily as professionals, but just as people. They, in fact, tweet and Twitter. You can go into a restaurant, I'm sure you've all been there like I have, 4 people sitting there, supposedly having lunch and getting to know each other. They're tweeting and Twittering. There's a couple of professors who were up here not long ago in Edmonton, from California and Boston, who said 97% of kids 0 to 4 years old, have a cell phone. And that 73% of parents say that they use their cell phone when having dinner with their kid. Now, how do you get in touch with, how do you keep close to the problems and the issues? How do you connect that family properly if that's what you do? There is, in Korea, and I've only been there once, so I can't say much about this, but apparently there's an internet disorder program where 250,000 people have gone. I'm not sure what it is, but we have to find some way. We're not going to end social media. We've got to find some way, especially with our youth, of reconnecting as opposed to causing this distance that's there. I mean, those professors also said that 58% of kids had been bullied over the cell phone, and none of them had said anything to anybody except when they were interviewed about it. Well, those are only some of the lack of connections we have. Of course, we have many others. One of them that we don't talk about often is actually with our own family physicians. And that is because we expect so much of family physicians. They learn how to deal with all of a person's issues from beginning to end. And in mental health, therefore, the amount of training that they were able to have on it, generally speaking, is not substantial. It's enough to start, but it's not substantial. And at least 2 families have talked to me about how their kids, that's older kids usually, but kids have gone to the family physician, talked about their depression, been given a medication, sent home, come back and told them again, get them the medication, went home several times, and then committed suicide. And, I understand the problem that the family physicians have. They have massive numbers of problems, constant number of people usually in their office at any one time. So the ability to get to the base of that problem is A, not time that they have, and B, the training that they've been through doesn't necessarily give them that kind of information. And I think one of the recommendations that was in the report that this Valuing Mental Health Committee had put forward from the Alberta government talks about what they're called navigators. That is that we should have people who can be attached to a person with a mental health issue and help them go through all of the different programs or places, whether they're professionals, whether they're nonprofit organizations, whether even they might be a place to find a right spot to live, and assist them in doing that. And if family doctors had that, I think that would be of assistance. Yes, they might not have the time to go further than giving out the pharmacology and saying a couple of words, but if they could attach to somebody else, they could follow on through it a little bit, that might help better. I also know that there's a number of other lack of connection problems. One of those is in crime. I was on the Edmonton Police Commission for about 6 years. I headed the Alberta commissions right across the province for a little while. And I was one of those involved in hiring, or then knew, who's currently still the chief of police, who used to be the uniform head of the RCMP for Canada. And he and I were talking not very long ago, and we both agreed that likely 80% of the people who have committed a crime have a mental health issue. And yet there's no proper connection. They go to jail, or they may go once in a while to a hospital, but they're not connected to deal with the mental health issue that's there. And if there were those kind of connections, we would help stop a lot of crime, and we would help a lot of people who have gone that direction. Well, it's now, I guess, a thing where we could try and look at some answers. And as I mentioned, I think this new program has a lot of those answers that the provincial government has put in place. Getting them in place is the issue, especially at a time when the finances are so poor. But I think that's true. I think that animals, many people don't think that's a very serious thing to talk about in mental health. You can tell from my life I wouldn't be here without one. And animals do provide a stable sense of caring, that our sense of caring often is complex and is on and off and depends on our emotions of the day. But an animal can provide that. And now the university studies are showing that as well. A German university says that an animal releases oxytocin, a neuropeptide that improves emotion, especially among youth when you deal with a dog or a cat. And there are some programs, like I mentioned, the one just outside of Edmonton, and the one I started, the CHIMO project, in that regard. but I think it's another area we need to seriously look at. You know, of all the mental health programs I've seen for 40 years in all parts of the world, most amazing was in India, a place called the Chalamuthu Trust. They had 10 different programs in 10 different parts of the south of India. They'd asked me to come to advise on community mental health, and my colleague, my friend, who was then president of the Psychiatric Association of Canada, came as well. And we walked in, my wife, who's here, was there with us too, walked in, and right from 1 to each of the 10, people were laughing, people were singing, people were having a good time. And that was part of what they were trying to do. They decided that happiness was part of a solution and bringing people together and connecting. And those weren't the only connections they had. You couldn't tell the difference unless you went and asked specifically who were professionals and who were clients. Everybody ate together, everybody talked together, everybody did everything there was together. And then they also paid every client that entered. Yeah, it was only like a rupee a day, just a little more than a couple cents. But even if the person could do nothing but rip up paper, they could use that to put in boxes to other things that were made by people that were sold. They made the people feel worthwhile. They made them feel like they're part of the community. Not just that I'm the doctor and you're the client, you have the problem. There was much more of a connection in that regard. And they had the 10 programs that went throughout a person's life and helped them do everything, including move into the community, have a job, figure out how to have a job, how to deal with the issue. I was amazed, and so was P.J. White, who was the psychiatrist who was with me, amazed at that program. And yes, I know we couldn't do the same thing here in Canada because we have evolved differently, but it's something we should see and try and work at and work towards dealing with. I know that Audrey Hepburn had said that I love people who make me laugh. I honestly think it's a thing I like most to laugh. It cures a multitude of ills. It's probably the most important thing in a person. And, you know, I know most of you haven't been laughing while I've been talking, and I'm not saying I'm very good at that. Yeah, I could learn more about that. But there's got to be some truth to that. We got to look at the possibility of involving that in the programs and the hospitals that we deal with as well. There's many other things, but all of it, in my opinion, in one way or another, it means connecting in a much greater way than we are currently. And I'll just mention one thing. I've been lucky in my life. I've got to meet kings and queens and presidents and prime ministers. But one of the most amazing guys I've ever met is here in this room today. And he has 2 honorary degrees. He has the Order of Canada. He has many other medals. And he's a schizophrenic. He lives in Alberta, paying people with low income money. His wife and his son have issues. And I don't know anybody else who, and I'm not one for sure, who knows how to connect more quickly, more often, or more constantly than Austin Martin. And Austin, you know, for example, I remember getting a call from him once. He was at a meeting in Montreal, and he said, and of course that's when the paranoia of the schizophrenia hits, and he knows it does from time to time. He says, I think somebody here is trying to kill me. And I said, and I knew what to say because we'd had this experience. I said, oh, why do you think that? And he told me, and then I went on to say, oh, what would make them do that? And we went through 10 questions, and at the end of it, he said, they're not trying to kill me, are they? And I said, no. And, you know, if I wasn't there, there was a couple other people he would have called. And I can tell you, boy, I haven't learned that much, but Austin, whether it's a problem for himself, his wife, his son, or others with mental health problems, he will call nonstop to get those connections, no matter how difficult or easy those are. And if we have a few minutes to have a discussion afterwards here, which we will have, Austin will join me, and if you want to ask about how you get those connections, you'll have to ask him, because he does them far better than I do. There's one other area, again sad, that I want to mention. First of all, we really have to know that we cannot necessarily think that a person with a depression takes a few pills, goes to a psychiatrist at an hour every month, and all of a sudden is better. Because things that start in our childhood, as most of these do, end up staying in our mind all the way around, and we to each other have to find ways of watching and making sure we're helping people get through it. And let me use me as an example. I spent 40 years never talking to my mother. And not long ago, I decided to drive to Calgary, take her for supper, spend some time with her, thought that would be good. Yes, she wasn't saying the things she had in the past to me. But when I got in the car to come home, I felt that useless, worthless feeling all the way back. And if I hadn't had my wife and my 2 cats and others there to give me again the security that I was worth something, it could have had me again. And, you know, people are not just easily done with. Fortunately, I have to also tell you that that's true of our organizations also. They may start good. They may start with the good intentions, and some do and then get better all the way, but some don't. The Mental Health Commission of Canada was one of the best ideas there was. I've had the honor of talking frequently to the man who started it all, and I think it's a great deal. They've done some great things. They still are doing some great things. However, over the years, all of the executive, the president, the chair, the 2 vice presidents, the 4 chairmen of committees are all from Ontario. Good people, trying to do good things, but without the national perspective that the commission is paid for and that it needs, that's there. They also have recently brought in a business management group that says, directors should not be telling the staff what to do at all. And I agree, you can't have 12 directors giving instructions to staff, but all the directors have a background and a depth of knowledge and different perspectives from different parts of the country in mental health, and they're not having any way of having any involvement except the very general direction and the accounting. And so that's why I didn't allow my name to stand for being reappointed for a second 3-year term, and why in 2 weeks I will leave it, and I've sent a letter saying that to all of the members of the board. But all I'm saying with that is that we always have to watch that the purpose of the organization, the purpose of what we're trying to meet, is something that we ensure stays there and gets better. Well, that's sort of the essence of it. And yeah, there's a lot of negativity in what I've said. I realize that. And Winston Churchill said, success is going from failure to failure without losing enthusiasm. And I think we have to feel that way, those of us who try and help in this whole mental health field. And so I want to thank all of you for spending your lunch hour here. You must be getting hungry. and listening to this, and I hope that in some way I've said some things can help you look at the different circumstances that you're in, and the different kinds of health activities you're in.